Your doctor has suggested you watch this presentation because you have some knee pain that might be helped by the exercises I'm going to describe later. First of all, I want to discuss a little bit about the anatomy of the knee so that you can understand why you might have what you have and why you might undertake a simple exercise program. To start off with the anatomy of the knee, first of all, let's have a look at the patella or the kneecap. And you can see, looking at the underside of the patella, that it's got two little facets on either side and a ridge in the middle. And those two little facets and the ridge are important in placing the patella and allowing it to move up and down on your thigh bone in the correct position. Now, your kneecap is controlled by a big muscle in your thigh called the quadriceps muscle. And there are four elements to that quadriceps muscle. They're all going to pull in slightly different ways. And it's the balance of the pull of the quadriceps muscle that in some part determines the way your kneecap will track over your thigh bone. And sometimes that tracking isn't quite right. You may feel a clicking or you may feel pain. And that may cause abnormal wear on one side or other of the kneecap. Kneecap pain is typically felt in the front of the knee or deep to the kneecap. It is usually not present when you're walking upright on the flat, but it is present if you walk down a hill or down steps or up steps, or if you're getting up from sitting or up from kneeling or genuflecting. You'll get a pain, and the pain is there usually until such time as you straighten the leg, and then it may just ease off slowly. The knee usually does not swell with patellofemoral pain, with problems from the patellofemoral joint. The pain is usually not present, or if it is relatively mild when lying flat, but it can be present if you're sitting with your knees bent for a prolonged period, as in a cinema or in a chair at home for an hour or two. And that knee can also be stiff when you get up from sitting for a long period like that. Usually pain from the kneecap doesn't cause pain during the night. If you understand the anatomy, then you can understand that a big part of trying to improve pain from the kneecap will involve trying to get the tracking right. And that seems to improve very well if you just strengthen the quadriceps muscle. And I'm going to show you an exercise, first of all, that stretches the quadriceps muscle. Bring the heel up to the bottom and reach back with your hand to pull and stretch the quadriceps. You can do this for about 10 seconds and then alternate to the other side while the left side is resting. And once that's been done, alternate across to the other side. Repeat this about 5 or 10 times twice daily. If there are difficulties pulling the shin, one can use a towel or belt or tie to bend the knee and stretch the quadriceps. Eventually the stretch will be good enough that you can help it with your hand. Alternate way of stretching the quadriceps is to stand, keep the thigh straight, bend the knee and assist the full flexion with your hand from behind. It is important that the thighs are kept parallel so that there is a stretch on the quadriceps on the front of the thigh. One stretches for about 10 seconds, relaxes for 4 or 5 and repeat the stretch. One can alternate from one side to the other. It is important to keep the thigh straight and avoid flexing the hip. Now that stretches the quadriceps muscle, and I think it's a good exercise to do before you do the strengthening exercise, and I'll show you the strengthening exercise now. First one is put a rolled towel under the knee, press the back of the knee into the rolled towel. This elevates the lower leg, point the toes towards the head, hold for 5 seconds and let the leg rest down slowly, rest for 3 seconds and repeat this. This will activate and strengthen the quadriceps. The next method involves lying flat. We'll strengthen the right quadriceps. So bend the left knee with the foot at the level of the right knee. Lift the leg so that both thighs are parallel and the foot is pointing towards the head. Lift for about 10 seconds and then let the leg down slowly under control, rest for about 5 seconds, and repeat this cycle about 10 times twice daily. That very simple exercise to strengthen the quadriceps muscle you can do either without any weight, or if it's easy then add weight to your ankle, and doing that twice a day until symptoms begin to settle, and then once a day for a long time after symptoms have settled, and do it on both knees, because even though one knee is only painful, the other leg will benefit. And you can do that for many weeks after your symptoms have settled. When you are symptomatic like this, then it is best to avoid unnecessary climbing or unnecessary squatting. As things improve, this will become more comfortable and you can get back to full normal activities. If over a week or two of doing these exercises diligently, your pain is not improving, then it might be a good idea to go and see your doctor again and reevaluate the diagnosis. He or she may want you to see a physiotherapist to have more specific therapy for this. Most patients with anterior knee pain from the patellofemoral joint, whether it's from inflammation in younger people or osteoarthritis in older people, will benefit from doing the quadriceps strengthening exercises in addition to any other treatments that are applied.